Imagine a city struck by an unexpected wave of pink eye cases. That's exactly what happened recently in Lahore, Pakistan. The Health Economic Times reported a staggering 85 new cases of this infection, a number that underscores the severity of this outbreak. Conjunctivitis, more commonly known as pink eye, is a highly contagious condition, capable of spreading rapidly within communities, as evidenced by this recent surge in Lahore. Now you might be wondering, what is pink eye and why should it concern you? A pink eye, medically known as conjunctivitis, is more than just a pinkish hue in the eyes. It's a condition where the conjunctiva, a thin layer of tissue covering the eye, becomes inflamed. This inflammation can be triggered by various causes, including viral and bacterial infections. But it's not just those pesky microbes that can make your eyes go pink. Allergies and exposure to foreign objects can be culprits too. Now, how do you know you've got pink eye? The symptoms are quite telling. Picture this. You wake up one morning with redness in your eyes. They're itching like crazy and they're watering as if you've just watched the saddest movie. You might notice a discharge, almost like your eyes are crying out for help. And then there's the sensitivity to light, swollen eyelids, and possibly even eye pain. But here's the thing about pink eye. It's highly contagious. It can spread like wildfire through direct or indirect contact with infected discharge. That means if someone with pink eye touches their eye and then touches a doorknob, and you come along and touch that same doorknob, and then your eye, you could catch it too. While it's usually not harmful to vision, it demands prompt treatment to prevent spreading. So how does one tackle this pesky condition? Let's dive into the treatment options. When it comes to pink eye, the first step is diagnosis. This involves a review of medical history and a thorough eye examination. In some cases, testing of eye discharge may also be required. These steps are crucial to identify the cause of the inflammation, whether it's a viral or bacterial infection, an allergy, or exposure to foreign objects. Once the cause has been determined, treatment can be tailored accordingly. If a bacterial infection is at play, antibiotics may be prescribed. In case of a viral infection, however, medication may not be as effective and the condition often needs to run its course. But don't fret. There are ways to manage the symptoms in the meantime. This can include the use of over-the-counter eye drops to soothe the irritation and reduce inflammation. For those who prefer a more natural approach, a warm or cold compress can also be applied to the affected eye to help alleviate discomfort. Another important treatment measure involves flushing the eyes, especially if the pink eye is due to exposure to foreign objects or chemicals. This process helps to cleanse the eye and reduce inflammation. But it's not all about medical interventions. There are at-home measures that can also be helpful. For instance, maintaining good hygiene is crucial. Washing your hands regularly, avoiding touching your eyes, and changing your pillowcase frequently can all help prevent further spread of the infection. It's also worth noting that specialized care for conjunctivitis is available at institutions such as the Aga Khan University Hospital, which offers support services and even financial assistance for eligible patients. But remember, prevention is better than cure. So how can we prevent ourselves from getting pink eye? Well, prevention is indeed better than cure, and with pink eye, this adage couldn't be more accurate. The most effective preventive measure against pink eye is maintaining good personal hygiene. It's not rocket science, really. It's as simple as washing your hands regularly and thoroughly. And when you don't have access to soap and water, use a hand sanitizer. Now, you might be wondering why all this emphasis on hand hygiene. That's because our hands often serve as vehicles for germs, transporting them from contaminated surfaces to our eyes. So the cleaner your hands, the safer your eyes. But that's not all. It's also crucial not to share personal items. This includes towels, washcloths, cosmetics, or anything that comes in contact with your eyes. It might seem harmless to borrow your friend's mascara or use a family member's towel, but remember, pink eye is highly contagious. Sharing these items can easily spread the infection, and here's another important tip. Avoid touching your eyes, especially if your hands are not clean. It might be a hard habit to break, especially if your eyes are itchy or irritated, but it's a small change that can make a big difference in preventing pink eye. In addition to these, if you know someone who has pink eye, try to avoid close contact until their infection has cleared up. And if you're the one with pink eye, do your part to prevent its spread by staying home from work or school until you're no longer contagious. With these preventive measures in place, we can all play a part in reducing the spread of pink eye. Remember, your health is in your hands.